It's good to have you join us on another fresh episode of Gist Nigeria from the BBC and Channels Television. Here we track stories on social media, in the news and dissect them. I'm Wali Fakile. Let's start with our top story. The migration of healthcare professionals from Nigeria is on the rise, and this is straining the country's health sector. President of the Nigerian Medical Association, Uche Roland, says Nigeria currently has only 24,000 licensed medical doctors, less than 10% of the number needed to meet a World Health Organization recommendation. In this report, Gist Nigeria's Abayomi Adisa assesses the impact of this exodus on healthcare in Nigeria.
A crowd of patients in desperate wait to get help. A scene dotted with doses of stress, pain and panic, typical of public hospitals across Nigeria.
At times you stay like 3 hours, 4 hours before you see doctor.
Sometimes you even go to the hospitals, you see that people lying on the veranda, there is no enough bed space.
Nigeria's health sector is hit by a virulent brain drain that is sweeping away many health professionals, leaving public hospitals understaffed and overwhelmed.
You have large numbers of trauma patients. You don't have enough hands to attend to them.
I'd say roughly 150 of us graduated back then, and nearly 2/3 to 3/4 are actually outside the country now.
A crisis so big and ugly. A trend experts fear could one day crash a sector in dire straits. Nigeria's population is rising fast, but the number of its health professionals is depleting even faster. In the last 5 years, at least 75,000 registered nurses and 7,000 pharmacists have left Nigeria to practice abroad. Between 2021 and 2022, about 1,200 physiotherapists, 1,352 radiographers, 400 optometrists and 300 dietitians jetted out of Nigeria. In 8 years, almost 5,000 Nigerian doctors have emigrated to the UK alone. Most of these health professionals are specialists.
It was difficult to see myself progressing in an environment that was understaffed, not well equipped, and there were many things that we learned which are mainly theoretical, and I really wanted to get sort of hands-on. Of course, the other thing was that there was a lot of problems with remuneration, problems with being undervalued as a doctor, not being respected by either other staff or the community.
Dr. Ogunleye's reasons for leaving are part of several orders that have been echoed in the news.
Healthcare professionals have become a target to kidnappers.
As health workers leave Nigeria in droves, their colleagues still practicing locally face an overwhelming pressure to meet patients' needs. University Teaching Hospital UCH Ibadan is one of the biggest teaching hospitals in Nigeria. In just 3 years, the hospital has lost 656 health personnel to brain drain. The 1,000-bed spaces facility now struggles to operate optimally.
Instead of maintaining about 2 or 3 wards, you start to maintain 1 or maximum 2. And of course, I must also make this known that the heads of departments in some departments are trying to adjust to this. For instance, the head of anesthesia told me they will not be able to cover anesthetic duties for all the surgical theaters, meaning that they had to collapse some theaters also.
In 2022, the Nigerian Medical Association said there were only 24,000 actively licensed physicians in Nigeria. For Nigeria to deliver essential services, the World Health Organization says it requires a mix of 23 doctors, nurses and midwives per 10,000 population. But this is at best a wish.
People are dying too because of overwork, because of this violence we are talking about. They are having burnout syndrome, they are having depression. And so and Nigerians are dying too because of the inadequate numbers.
The situation is more critical in northern Nigeria.
A lot of practitioners from the south are moving away, creating vacancy. Now, a lot of practitioners that are based or resident in the north are from the south. Now, with this creation of this vacancy in the north, they are drifting toward the west, towards the south. You understand? Thereby creating more vacancy there.
It's not a story to rejoice over. It calls for an emergency rescue by the government.
Nigeria's federal government has made some interventions in the past.
The consolidated medical salary scale and the consolidated healthcare salary scale, the CONMES and the CONHES, which are dedicated for the medical and healthcare workers. This is one of the initiatives of government. However, it is due for review. It was proposed in 2009 and implemented in 2014. It is due for a review.
In September 2021, President Muhammadu Buhari set up a health sector reform committee to address challenges in the sector. Almost 2 years after, healthcare in Nigeria remains in crisis. Resident doctors are the largest medical workforce in Nigeria. On May 17, 2023, they downed tools to demand improvements in the health sector, especially the upward review of their salaries, recruitment of more medical personnel, and infrastructure. While they seek improvements, patients were left to their fate.
That 5-day strike was just to tell the government that, look, we are done with these delay tactics.
The Doctors' Union called off its warning strike on the 21st May 2023 after entering an understanding with the government. While Nigeria struggles to resolve the crisis in its health sector, many Nigerians are seeking treatment abroad. President Muhammadu Buhari and President-elect Bola Tinubu are among them. Experts say the country loses about 576 billion naira yearly to medical tourism.
And that's open their doors.
In April 2023, lawmaker Abiodun Ganiyu Johnson sponsored a bill to mandate doctors to practice for a minimum of 5 years in Nigeria after their medical training before being granted full license. The bill passed the second reading on the floor of the Assembly.
Instead of finding out the problem and solving it, we bring a quick fix that will destroy the medical profession totally.
The cause of why doctors are moving cannot just be stopped by saying you deny them license.
With a lot of backlash from health professionals, the federal government dismissed the bill, calling it unworkable. In April 2023, the United Kingdom placed Nigeria and 53 other countries on a red list of countries to actively recruit health workers from.
The new government that is coming up should look away from us, the healthcare professionals. Let them appoint seasoned administrators.
They need to improve on security. They need to improve on infrastructure.
Improving the remuneration, improving the work environment, by creating a conducive environment and improving job satisfaction.
Until Nigeria's health sector is fixed or even stabilized, more health professionals may continue to leave the country in search of greener pastures, and quality healthcare will without doubt remain elusive for over 200 million Nigerians. Abayomi Adisa, Gist Nigeria.
Indeed, improving the wealth of Nigerian healthcare professionals will go a long way in reversing this trend. Tutors at Gist Nigeria TV would like to hear from you.